CAS review.
My Lords, Dr Cass and her team are to be thanked for their rigour and their care with this report, in which they have navigated many complex and sensitive issues. This review into the NHS's gender identity services concludes that children and young people have been let down by inadequate research and evidence on medical interventions, and they've been failed by inadequate services amidst a debate which sadly has been marked by extreme toxicity. And at the same time, at the heart of the complexity around gender identity services are two aspects that are simultaneously true. There are trans adults who have followed a medical pathway and say that for all the pain and difficulty involved, it was not just life-affirming, it was life-saving. There are also people who've followed a medical pathway and say that it's ruined their lives irreversibly, and ask how anyone could let that happen. For those children, young people and now adults, but particularly those who are being referred into gender identity services today, there is a duty to get this right. My Lords, the CAS review refers to many scandals, which exposes both the inordinate amount of time that children and young people are waiting for care whilst their well-being deteriorates, and medical interventions that have been made on what could be called shaky evidence. So can the Minister say how it came to be that NHS providers refused to cooperate with this review? How was it allowed that adult gender services would not share data on the long-term experience of patients? What accountability does the Minister feel that there should now be? The Minister will know that the discussion around the substance of the review has been highly toxic. People have felt silenced, and it has required investigative journalism to prompt this review to take place. Tribute should be paid to journalists including Hannah Barnes and to the whistleblowers who together helped shine a light on the Tavistock Clinic. It is concerning to note that Dr Cass said, "Toxic, ideological and polarised public debate has made the work of the review significantly harder," and that it will hamper the research that is essential to finding a way forward. This particularly vulnerable group of children and young people are at the wrong end of the statistics when it comes to mental ill health, suicide and self-harm. They've been badly let down, and so we owe it to them to approach this discussion with the sensitivity it demands. My Lords, parts of this report today will sound very familiar. Services unable to cope with demand, significant staff shortages, and a lack of workforce planning. Unacceptably long waits for the mental health support and the assessments that children and young people need, such that in some cases children become adults before they even get a first appointment with the gender identity services. And to this point, the CAS review recommends a follow-through of services up to the age of 25 to ensure continuity of care. Will the Minister indicate how long it will take to establish these services? And could the Minister set out what plans there are to cut waiting times for assessments for mental health and neurodevelopmental conditions? My Lords, last month's decision by NHS England to stop the routine prescription of puberty blockers to under 18s is welcome. However, the loophole that exists for private providers risks illegal trading. In the other place, the Secretary of State stated that she expects private clinics to follow the report's recommendations to follow the evidence, and I underline our support for these expectations on compliance. So does the Minister consider that further regulation might be needed to enforce the recommendations? And could he say something more about the timescales involved in making progress, both for the CQC to incorporate the recommendations into their safe care and treatment standards, and the NHS England urgent review on clinical policy for cross-sex hormones. Children's healthcare should always be led by evidence and be in the best interests of their welfare. Dr. Cass's report has provided the basis on which to go forward, and this report must also provide a watershed moment for the way in which society and politics discusses this issue. There are children, young people and adults, including trans children, young people and adults, who are desperately worried and frightened by the toxicity of this debate. And there are healthcare professionals who are scared to do their job and make their views known. I hope, my lords, we can now put children's health and well-being above all else.
Yeah.